Here's my audience. Okay. Norco College serves 16,000 students annually. Whether part-time or full-time, they employ a number of people to help these students navigate their college life. Now imagine there's only one or two people to help them navigate this insane time in their lives. You didn't know who to go to for financial aid offers or help you with your class scheduling. You didn't know who's going to be coaching the soccer team or who is going to be leading the school choir. That is what it's like for patients in hospitals every day. Over the next few minutes, I'm going to persuade you to expand the patient advocacy departments in all California hospitals. In July 2022, Joy Genoit reported with the California Health Foundation that from our 337 hospitals, they served 2.9 million patients. And if you did the math for the average amount of patient advocates in hospitals today, that's about 4,000 patients per advocate. First, I'm going to inform you how many current advocates are employed. And next, we're going to discuss how expanding patient advocacy helps citizens and patients and hospital staff. And finally, we're going to show how the expansion of patient healthcare helps Californians today. First off, California hospitals do not employ enough advocates, patient advocates, to accommodate all of the citizens and patients they see every year. HealthWise reported with the medical article from 2023 that most California hospitals employ 1 to 2 patient advocates. This means if you recently had a baby and you don't know how the billing is going to be, if you are having a surgery done and you need more in-depth explanation, or if unfortunately you had a loved one pass away and you need help with the death certificate, there's only 1 or 2 people in the whole hospital that can help you. But Californians deserve to have a person dedicated to their case each day. In 2022, Tara Parker Pope wrote with the New York Times that she had to call a patient advocate when her father was admitted to the hospital. His room needed to be changed, and using her patient advocate, he was able to change rooms that day. Thankfully, her dad was able to spend the last dying moments with his wife. This visual aid shows the nurse-to-patient ratio in most California hospitals today. If you look closely, this shows California Department of Health Services and their nurse-to-patient ratio, and this is Kaiser nurses and their nurse-to-patient ratio. Now, if patient advocates aren't available, nurses are unable to dedicate their health care to their patients because they're fending off questions and updating family for their patient. If there are more patient advocates, then nurses will be able to better focus on their job. The lack of patient advocacy in California hinders not only patients but also hospitals. But here's how developing departments can help hospitals and patients. Tulane University in 2021 highlights the importance of patient advocates. They do a number of jobs throughout hospitals. This includes helping you schedule appointments, if you need to transfer medical records, if you need to be admitted or discharged from a hospital. They can let you know your patient rights and also help you with patient billing. Now, Miller wrote with the Journal Benefits of Conversation in 2006 that there are a lot of nonprofit organizations and a lot of patient advocacy programs that can teach normal citizens how to become patient advocates for themselves or for their family members. However, this is not ideal because each hospital is slightly different. That's why it's better for each hospital to have their own patient advocacy system so that each advocate knows the ins and outs of their hospital and can better service their patients and those family members. Now, we've heard how little patient advocates are in hospitals now, and we know that if adding more patient advocates to hospitals will be better, let's look how, in the long term, how patient advocates in California can help Californian citizens. In 2023, Dylan Scott wrote for the online journal Vox that people avoid healthcare for a number of reasons. Maybe the medical expenses will be too high, so they skip appointments, they change their diets because they think it's preventative, or they're lacking in the knowledge of our insurance for our healthcare system. If we have advocacy statewide, that means that patient advocates can speak to people and talk to them about their plans, their insurance plans, and how to help lower their bills. At this next visual, you will see the number of people who are uninsured that had no preventative care in 2020 was 60.7%, this number right here. That's a large amount. However, if we had patient advocates to let people know about preventative care and about our insurance plans and about our healthcare system in California, people wouldn't have to skip out on appointments and they would get preventative care for things like diabetes or early stage cancers. Today, I have spoken to you about our lack of advocates and how developing a patient advocacy system in California hospitals can benefit citizens mentally, physically, and emotionally. When I look back at the times I've been in the hospital with family or friends, I noticed times when I was able, or we were able, to reach out to patient advocates in the hospital to know more about the billing system, about the procedures being done, or about the general knowledge about the hospital. I recommend that next time you're in the hospital or with family members, you reach out to the hospital's patient advocate to know your options and to know your patient rights. Patient advocacy in hospitals are important because it empowers patients and citizens to take care of their loved ones and themselves.